Question. A 34-year-old client with bipolar disorder is admitted to the emergency department. The client has been on lithium therapy for 8 months. Current findings. Symptoms: severe nausea, vomiting, blurred vision, coarse hand tremors, confusion, ataxia. Vital signs: BP 88 over 56 millimeters of mercury, heart rate 118 BPM, respiratory rate 22 per minute, SpO2 94% on room air, temp 99.2 degrees Fahrenheit, 37.3 degrees Celsius. Labs: serum lithium 2.1 milliequivalent per liter, sodium 128 milliequivalent per liter, creatinine 2.3 milligrams per deciliter. IV access: saline lock present. The provider is not yet at the bedside. Which action should the nurse take first? A. Immediately notify the provider of the client's condition and withhold lithium. B. Initiate IV normal saline at a rapid rate to promote lithium excretion. C. Place the client on continuous cardiac monitoring and monitor for arrhythmias. D. Prepare the client for possible hemodialysis. Answer. A. Immediately notify the provider of the client's condition and withhold lithium. Rationale: this client is showing moderate to severe lithium toxicity, serum level 2.1 milliequivalent per liter, with neurological impairment, confusion, ataxia, GI distress, hyponatremia, and renal dysfunction. These findings place the client at high risk for progression to life-threatening complications such as seizures, coma, or cardiovascular collapse. A. Correct. The first and most critical nursing action is to withhold lithium and immediately notify the provider so urgent interventions for fluids dialysis can be ordered. This prevents further toxicity and ensures rapid escalation of care. B. IV fluids may indeed help lithium clearance, but initiating a rapid bolus without a provider order, especially in a client with renal impairment, creatinine 2.3, may worsen complications like fluid overload. C. Cardiac monitoring is important because lithium can cause dysrhythmias, but it is secondary to stopping the toxic agent and escalating the situation. D. Hemodialysis may be indicated with renal dysfunction and high lithium levels, but preparing for it is a later step after notifying the provider.